Hi, welcome to this bite-sized session on the NHS Improvement Making Data Count initiative and a brief introduction to statistical process control charts. My name's Deb Cundy and I'm currently a Service Development Manager in Clinical Operations with responsibility for the production and presentation of various performance and quality information across the Trust. So in this session, I'm going to introduce the Making Data Count NHSI methodology. I'm going to ask us to think about information and the way that we present it, how we're used to seeing data, analysing it and making decisions based on it. We're going to look at the theory behind variation and understand common cause and special cause. Then we'll have a look at what an SPC chart actually is, look at special cause variation and SPC rules and how we can use SPC for assurance. We'll consider the benefits of SPC, share a little bit of information on how to create SPC charts yourselves, and finally point you in the direction of some great resources to go away and explore more. So why is information important? Information has been described as the lifeblood of the NHS, a vital asset for the clinical management of individual patients and the efficient management of services. So Dr. Geraint Lewis, the Chief Data Officer for NHS England, has said, high quality information will empower the health and social care sector in identifying when new care is needed to meet the needs of local populations. Using data, we can determine what care is working well and what needs to be improved, allowing patients, clinicians and commissioners to compare the quality and efficiency of care in different parts of the country. We really need to understand through evidence our services, our teams, our patients and so on in order to be able to assess how we are doing, what we need to do, what could improve and also to identify where we're doing something well. Too often we jump to conclusions based on hearsay, assumptions or anecdotes. I'm sure you can think of examples when you've been asked to make a change or suggested a change in practice as a result of an anecdote or a hunch or a feeling that something's not right. So the Making Data Count is a guide that was published in 2017-18, followed by a second guide last year in 2019. And the guides are designed to support people working in the NHS to make the best use of data to inform judgments and decisions for action. They're aimed at everyone, people responsible for analysing, interpreting and presenting data to others, and for decision makers, for example, managers and clinicians who need data to answer questions. They describe why we should be presenting and using data more effectively and how to do it. They're great guides full of real-life case studies and exercises illustrating the different perspectives that clinicians, managers and analysts bring and show how closer working between these groups can add great value. And in really simple terms, Making Data Count is about us moving away from red, amber, green, RAG and two-point comparisons like this, and moving to presenting data in a more useful way. So what's wrong with two-point comparison? Brucey has the answer. It's always higher or lower, or the same. But higher than last month is not a trend, it's just not the same as last month. Here are some real examples of RAG and month-on-month comparison data taken from real Trust Board and performance reports, including our own, and I'm guessing that they'll look familiar to you. We often see data like this, and which people often react by circling numbers and little else. It's really impossible to tell anything from that information if we're honest. Most board papers contain data that looks like this. A sea of red, amber and green just looks like a traffic light. And this one, a sea of green where everything looks great. Everything must be fine with these indicators, they're all green. If that was in a 70-page board report, how long would you spend looking at that? I'm now introducing you to Walter A. Shewett, who developed a theory of variation in the 1920s. In the real world, everything varies. How long it takes to travel to work, how long it takes to record a patient's blood pressure, how many patients need a home visit today. Think about your journey to work. Does it take exactly the same time every day or does it vary? It'll be slower if the ticket machine is broken or if there's a queue for the lift. It'll be quicker if there's no traffic on the road because there's a global pandemic. This is an example of what's called common cause variation, variation that's outside of your control. You can't say exactly how long your journey to work will take on any particular day, but you can give a range for what you would expect. And in turn, this guides what type of action is required, which in some cases may be none. All too often, we overreact to variation which is normal, and we waste lots of time investigating a deterioration which SPC actually tells us is normal. So, what is an SPC chart? An SPC chart is a time series graph, a basic run chart with the addition of 3 lines. So what are those 3 lines? Firstly, there's a mean or average line in the middle, and then there are 2 lines called control limits or process limits, an upper and a lower limit. 99% of data points will fall within these limits. The control limits are set by the values themselves, and they represent common cause variation as you would expect to see in any kind of process or system. You do need a minimum number of data points to create robust SPC charts, and at least 15 is recommended. Between 12 and 15 is okay. Importantly, there are SPC rules. Most of us don't need to understand the detail of these rules. They're based on probability. I definitely don't understand them. I just take them as they are given. So there are 8 rules in total in SPC. The simplest ones are these 3. So firstly, we've got a single data point outside the control limit. So whenever a data point falls outside a process limit, upper or lower limit, something unexpected has happened because we know that 99% of data should fall within the process limits. Our next point is a shift of points above or below the mean line. So a run of values above or below the average line represents a trend that wouldn't normally result from natural variation in the system. And the key consideration in this rule is how many data points you decide represent special cause variation. Now, most people use between 7 and 9 points, and we should decide the number based on how frequently we want to ask the questions of the system or process. The lower the number, the greater the chance that special cause variation will be identified. So if, for example, we're looking at monthly data, we may want to use 6 points, as 6 months would be long enough to see any improvement. But if we're looking at daily data, we might want to choose a higher number to avoid too frequent interventions. So what we can be sure of is that a run of fewer than 6 points is insufficient, as it can occur randomly, and it could result in us making changes to our process or system unnecessarily. And thirdly, then, one of the important rules to look at in SPC is a run of 6 or more values showing continuous increase or decrease. And that's a sign that something unusual is happening in our system. So it doesn't matter where the run starts or finishes in relation to the mean line, and it's widely accepted that 6 data points are sufficient to represent special cause variation. How many times have you heard people talking about a trend when a trend consists of 2 or 3 data points? Back to that month-on-month comparison. We're going up, when actually something is just higher than it was last month. For robust interpretation, a trend needs to have at least 6 points. If one of the SPC rules is triggered, this is called special cause variation, and it means that an unusual pattern in the data has occurred which should be investigated. An example of special cause in our journey to work scenario that we talked about earlier might be if you drive a certain way to work each day and on average it takes you between 20 and 25 minutes, if one day there's an accident on your route which causes a delay and it takes you 40 minutes to get to work, that special cause has been that accident which causes the delay. So why do we choose 7 points to highlight special cause, trend up or down? It's all to do with probability, which stretches my brain a little bit too much, but put simply, the chance of the system randomly improving or declining is 1 in 128 if we use 7 points. In other words, it's very unlikely to occur unless something is actually happening. So if there is special cause, it's an indication to investigate. Have a look and see if you can identify what's made the system behave in this way. Examples of this can be when we focus on the achievement of a particular goal and make improvements. For example, recently we've been seeking to improve our compliance with supervision and recording of supervision, and that's paid off. We've seen an improvement. If you were monitoring the number of assessments undertaken within a service and your SPC chart identified special cause decline, maybe that could be due to staff absence or vacancies within the service. So back to Walter. All too often, we overreact to variation which is normal, and we waste lots of time investigating a deterioration which SPC would tell us is normal. So if we look at some of the information that we looked at earlier, this is the same data as the previous table of numbers. The time series is extended, and these are SPC or control charts. And by using SPC charts, we see a different picture. The green colour coding in the IAP charts before masked deteriorating performance, which we can see on that bottom left-hand corner chart. One thing to point out is that if a system is in control, it doesn't necessarily mean that we don't need to take action. A system might be in control, but not capable of delivering the required standard or target. In this case, the system needs to be redesigned. Or a system can be in control, but the range or level of variation is unacceptable. An example of that might be referrals into a team. You may be targeted, funded or staffed to deal with a certain number of referrals per day, week or month. And you could see common cause variation where the range in referrals makes it very difficult to manage in your current model. So SPC can help us in this way to look at what system we need to put in to manage the level of variation. So, in short, SPC provides statistical rigour to help us understand when something unusual is happening in the system, for good or bad. Without these, it's left to interpretation, with one person able to say something is wrong and another one saying it's not. Okay, thinking about us in SHSC and SPC, the SHSC way. So we've created a version of the NHS Improvement SPC chart tool to use within SHSC. And our aim is to use this tool consistently across the organisation when we're considering time series data. Here's some examples of the information that we're providing using this tool. We've got our daily dashboard, COVID daily dashboard, and that first example was the staff not working due to COVID absence. We've got weekly referrals data, referrals to IAPT, and we've got admissions data, which is monthly data on there. So we've got a tool, a template that someone has created for us in Excel, and we're looking to create that tool in other software in the future. So if you want to have a look at this tool and start to use it with your data, please get in touch with me at deborah.cundy@shsc.nhsuk.uk. These are the icons that we're using in our tool. They're taken again from the NHS Improvement icons, but we've added one in for use within our own organisation. And you'll see that there, it's the purple icon in the variation icons, which is where we can identify special cause variation, so either a trend up, down, or a shift above or below the mean, but where we don't know whether something high is good or something low is good. So an example of that again could be referrals into a service or a team. We might know whether high or low is good if we have a target for the number of referrals that we're expecting to receive, but we might not, and we might just want to know whether referrals are going up or going down, and that's not necessarily a good or a bad thing. So we wanted to be able to highlight that So we're using the purple dots in that instance. So you'll see there you've got icons that represent on your SPC charts whether you're experiencing common cause variation, special cause variation, where neither high nor low is good, special cause concern, where low is good, special cause concern, where high is good, improvement, where high is good, or improvement, where low is good. So those are the variation icons. And then we have the assurance icons. So if we have a target or an expectation set, the icons display on the charts based on the whole visible data range. So if your system is unlikely to meet the target or expectation, you'll see that orange F icon. So that's an indication that you're likely to not meet your target. You would see the blue P icon if your system is consistently achieving the target, and you'll see the grey question mark icon if your system is randomly meeting and not meeting the target on the basis of your common cause variation. So I'm aware that I've covered quite a lot of material in a relatively short space of time. So finally, just want to leave you with some links to go away and find out more. Encourage you to think about whether there are things that you can change in your practice to help SHSC on our SPC journey. And that might be something as simple as challenging a decision or statement if you can see that it's based on nothing more than anecdotal information. Or it might be something as complex as creating the code for an SHSC SPC tool in a new piece of software. We've all got a part to play in this journey. So thank you ever so much for listening, and please get in touch with me if you want to find out more or you've got any suggestions for us. Thank you.